We are now recording. All right, everybody, thank you for joining. This is Dr. Ed Park. Today we're going to be talking about hair loss. So, the goals of today are to talk about what causes hair dysfunction, what is hair, and I can't get into my experiences with TA65, but there's a lot there. If you want to learn about hair much more than you'd ever want to know, go to the video tinyurl.com/Dr. Park Hair. And there you will see like an hour-long video explaining a bunch of remarkable cases of hair regrowth and repigmentation from people who are taking TA65. As many of you know, I am still selling TA65 telomerase activators. And if we look at the octagon above from my first book, Telomere Time Bombs, I make the argument, which I think has pivoted and morphed a little bit, that age-related diseases is largely related to telomere dysfunction. I think that's true, but there's also other things like epigenetics which are at play. And so check that out, or The Telomere Miracle, also the second book I did for Hay House, and that will explain the theory and how that could be the case. So I make the argument in my books that aging is really stem cell depletion. And what is stem cell depletion? It's overuse, but it's also uh, differentiation. So what do I mean by that? Well, we know what happens when you take chemotherapy. In chemotherapy, your hair falls out, also rapidly producing cells like in the brain and in the gut. They also get damaged, as does your immune system and hopefully the cancer cells. So that's local stem cell destruction. What we see is that in the progerias, which are the rapid aging syndromes, we see these kids are usually bald, thinning, gray, and so that's a pretty good indication that there might be something going on with telomeres, stem cell depletion, and aging, because these prematurely aged children are bald. Oh my goodness, my thing just keeps on going out and out. All right, so without belaboring the point, what we have here is a lobster that's big and a man that's normal. Lobsters and other invertebrates like jellyfish, the giant squid, they have a lot of stem cells and they persist throughout life. Since the animal is in the ocean and the ocean is limitless for all intents and purposes, it can grow really big. People, on the other hand, have puberty, they have growth plates, and they stop growing because you can't just keep on outgrowing your hatchback. So the point I wanted to make, and you can explore very in depth, one of my first videos over 11 years ago was about premature aging syndrome, is called tinyurl.com/Dr. Park Progeria. And in it, you'll see a breakdown. There are some diseases in which telomeres are not shortened, and they're not associated with hair loss either. The ones that are associated with alopecia are the top three there: Rothman, Thompson, Werner, Hutchinson, Guilford, and dyskeratosis congenita. Dyskeratosis congenita. And so we see dyskeratosis congenita, it really means that the telomerase is not working and the hair falls out. So there's a pretty strong reason to think that this is not only associated, but also causal. Oh, that little cartoon to my left here is meant to illustrate that every hair is a little universe. And this is very important to understand. When the hair is growing, it's connected to the dermal papilla. That's that little green bud at the bottom. So when a hair is growing, it's called anagen phase, from Greek for, I guess, going up or growing. And when it's stopping, it's in catagen briefly, and then it goes to telogen, which is rest or end. Telo is end. So you see that in telogen and catagen, the hair is not connected to the root bulb, the green dot, and that is where you need the stem cells to reside to actively grow a hair. Very important principle in hair growth. Okay, I remember watching a movie, Pink Floyd The Wall, and Bob Geldof shaved his eyebrows. I thought, oh my God, I'd be so scared. How do we know the eyebrows are going to grow back? Well, the truth of all hair growth is that hair is always growing everywhere, and except when it's not, when it's in rest or telogen phase. So if you look at this amazing chart, someone or the scientists have mapped out why hair grows certain length. Why don't your eyebrows grow longer? For example, uh, so we have a situation where the eyebrows will grow for 1 to 2 months and rest for 3 months, and that is what limits the length. Whereas the scalp can grow for 2 to 6 years, you can get really long hair on the scalp, and so you can study this chart more if you like. But the point is that again, in the simpler cartoon to our left, we see that when the hair is a long time in telogen and a short time growing, that is what determines the ultimate length. And the next time it falls out, um, it can be pushed out by a new hair formation. So all of our hair is determined by the length, the duration, the programming, and it's obviously purposeful, which is quite interesting. Of course, everyone knows that there's a role for hormones to play. We see this man on the left, and that pretty much sums it up. Androgenization is characterized by muscle growth. You have square angular features at baldness and a lot of hirsutism, but not hirsutism or hairiness on the head, which is a bit ironic. There are many theories about this, none of them exactly clear. But we do know that male pattern baldness, as opposed to female, it tends to be on the vertex where the yarmulke goes, and then, or the crown, you could call it, and the temporal areas. And it's a paradox that it makes you hairy everywhere else but the top of your head. That may be related to something called keratin KRT37, which in other higher order primates is variable, and so our keratin on the head might be different. We also see a relationship to aging, but also inflammation. So inflammation in the form of prostaglandins, TGF beta 1 and 2, insulin-like growth factor may play a role, and of course, dihydrotestosterone or testosterone does contribute significantly. There may be residual stem cells. We do see hair regrowth. And so we always say, well, look at the cartoon above. There's a stem cell repository, that little red bulge. That's where they go down into the dermal papilla and start the next growth for melanocytes and hair follicle stem cells. If that bulge is still preserved after chemo, you will regrow your hair. If you've been male pattern bald for years and it somehow is revived, then you can, I guess, grow new hair. More esoteric, but much more important and mysterious, is the diagram to the right of the hair follicle. This comes from an article about stem cell niches, and suffice to say that, as I explained in the octagon, we have niches throughout our body, in our retina, in our hair cells, in our stomach, everywhere. There's a constant dialogue between differentiation and preservation. So this diagram kind of shows that some of these cell differentiation factors like WNT that are well known, they all kind of contribute to this final common pathway of C-MYC, which is an oncogene. So all you need to know is that if the C-MYC oncogene is not working, you can get differentiation. And in the case of stem cells, differentiation is bad. So the hair will no longer grow. This is caused by telomere erosion, overcopying, different switches, yes, yes, and yes. And so the cartoon immediately to my left shows what I'm talking about. Stemness is two things. One is immortality. In other words, they have telomeres to lengthen their telomeres so they don't ever copy out. It's a forever good. And then asymmetric differentiation. So what we see there is the progenitor cell differentiates into two copies, one daughter with a function and one copy of herself. So mom, when she splits, she goes into a daughter and a mom, a daughter and a mom. Sometimes you get an intermediate one and you lose some of the magic or the potency of the mother. So that is what a stem cell is. It's one that is immortal and asymmetrically divides. So when you get differentiation and the mom goes into two daughters, it's game over. That stem cell is depleted, it's differentiated, whatever you want to call it. It's lost its stemness. Okay. Hair loss can also come in the form of this sort of like mange. In dogs, it's mange, but that's more parasitic, I believe. In humans, it's called alopecia areata. Of course, it can come in little patches, which is reminiscent of the patches of vitiligo. Vitiligo, the melanocytes will be attacked by one's immune system. If it's total on the head, it's called totalis. If it's universal on the whole body, it's called universalis. So the immune system is not to be trifled with. It can attack the host in different niches, and when it does that, you can get bad things like immune hair loss. Of course, these pictures are trying to illustrate MHC class 1 and MHC class 2. Suffice to say that all your nucleated cells have class 1, and class 2 appears on different kinds of antigen presenting cells. So basically, it's like a little code, a passcode. This is the secret handshake. This is the way that we know friend from foe. And any kind of, it's always a dance between your body, your T cells being trained to recognize the secret handshake, who's friendly, and yet to be aggressive as well. And that kind of training happens in the thymus, hence the name T cell. But autoimmunity is certainly at the heart or the crux of a lot of our problems. So as we get older, we develop more autoimmune type of problems. So there could be a role in hair loss from autoimmunity. Graying is also stem cell depletion of a certain kind of stem cell, in that you can see in the cartoon to my left, at the bulge, there's two types of stem cells. There's the stem cell of the hair follicle, the HFSC, and there's the melanocyte stem cell, or the MSC. So every time you want a new crop of hairs, these little buggers have to migrate down to the bulge and start growing a new hair. Of course, they can individually become dysfunctional. What's interesting is many years ago, I was giving TA65 to this lady, the oldest lady in California at the time. I think she was 112. And she, after taking TA65, sprouted hundreds of little black hairs. It was very interesting. So if you want to watch that video, it's quite fun. From her birthday, tinyurl.com /Dr. Park Soledad. And there's two studies there that are cited talking about reversing hair grayness in mice using different telomerase tricks. So there definitely is some kind of relationship there. All right, when we talk about treatment, there aren't really any good medical treatments. There are some fairly good surgical treatments. We talk about minoxidil, the mechanism of which is really not understood. There are only speculations. It works well. It can cause some swelling. It's very oily, and you have to be on it chronically, otherwise the effects are lost. It also can cause a unique kind of degradation of the papillary muscles, or the muscles that hold the valves in the heart. So that's a little scary. We have finasteride, or Propecia, which is an anti-prostate drug. It's a 5-alpha reductase competitive inhibitor. So DHT is dihydrotestosterone. It's the more potent form of testosterone. So when you take a 5-alpha reductase inhibitor, you only have testosterone, not dihydrotestosterone. So you get a decrease in erectile function, libido. You can get increased breast growth or gynecomastia. But the hair does regrow because your overall androgen effect is less. One interesting syndrome, a couple of famous actresses, Kim Novak, perhaps Jamie Lee Curtis, had testicular feminization. That's where you have no alpha reductase receptors, or no testosterone receptors, rather. So you have actually the pure female who is born with testicles. So they have, very curvy, typical secondary sex characteristics, large breasts, and no body hair. So that's an interesting experiment that nature has done. Spironolactone is also an anti-androgen. It's used off-label for hair regrowth, but it is kind of dangerous because it causes an increase in potassium or hyperkalemia. Of course, corticosteroids applied topically can be effective. They can be absorbed systemically, off-label use. Of course, asulfidine, which is pro molecule for aspirin, a prostaglandin inhibitor, is also effective. I remember my dad used to have a hair tonic that he would make, comprised of, I think, a little bit of aspirin, a little rubbing alcohol and maybe a little steroid. And for some reason, for some people, can help with hair loss, maybe even prompt growth. And there are people who have experimented with that, as we'll get into a little bit. When it's time for a transplant surgery, there's two options. There's the original FUT, which is follicle transplant. That's a strip. And that the downside is you get a linear scar, as shown to my left here. And they just take the hair from one part where it is growing and they put it where it ain't. Um, Another newer tech is called follicular unit extraction. And these make 1 to 4 hair follicles in a little punch biopsy, and they're moved from where it ain't to where it needs to be, or from where it is to where it needs to be. And so that's both probably a better cosmetic result without the scar, and takes time, sometimes multiple sessions, but it is well tolerated. All right, let's go to 3 cases, and I'll wrap up and kind of sum up afterwards. JB is a 66-year-old man with seborrheic dermatitis. He has been a taker of TA65 for probably a dozen years. So he flew out when I was in Hawaii giving lectures. He flew out twice from New Zealand. And the first time he got treated, it really helped his seborrheic dermatitis and resulted in some hair growth temporarily. So let's read what he wrote to me 2 days ago. The procedure for growth was a zilch for me, except for a brief period, about 8 weeks, where there seemed to be fast-growing dark hairs. They were noticeably out of place by comparison. From the standpoint of seborrheic dermatitis, it did seem to alleviate that. It subsequently recurred, and I'm back to rotating between tar, selenium, ketoconazole, which is an antifungal, and salicylic acid-based products like sulfasalazine that I mentioned. So what we see is at the first lecture at the Royal Hawaiian, this is the before photo. It's quite scaly, patchy, and red. And then when I gave a lecture at University of Hawaii, it was a little better, and at least according to him, less itchy and less affected. Of course, these are not FDA approved to treat hair loss, exosomes that is, but here's another interesting case. KW, he just emailed me his photo about 20 minutes ago, so I was able to incorporate it. He's a 62-year-old man with plantar fasciitis, but he was kind of like all in. He wanted to really try and fix things. So last May, we did an overhaul, and he got, I think, the most number of treatments on the same day. He got both shoulders, 2.5 billion into both subacromial bursae, 5 billion epidural in the lumbar L4. He did both nasal sides. Um, uh, yeah, and we did IV, both knees, left ankle, and a bunch in his plantar fascia. So he was happy that his plantar fasciitis went away. And then 2 months later, he said, "Hey, doc, I've been reading good things about hair growth. Can we try that?" I said, "Sure, why not?" So we numbed up, shampoo, numb up with benzocaine, lidocaine, tetracaine, and used the microneedling pen to 2.5 millimeters depth. This is kind of what it looked like before. And we used only 2 billion mesenchymal stem cell exosomes and 2 billion of amniotic fluid exosomes as well. Initially, there was some sparse growth, but then he decided to go back to minoxidil, which worked for him 20 years ago. I don't know why he didn't take minoxidil in the interim, but he says it's greasy and he doesn't like it. It causes edema. He only uses once a day. But whether it was the minoxidil or maybe the combination of prepping with the exosomes, maybe it changed the phenotype or the inflammation. Perhaps it resurrected some stem cells. It does seem that the hair is significantly improved, and he's very happy with that. Of course, he attributes it almost all to the minoxidil, which raises an interesting point, which I'll get into. AD is a 66-year-old man. You can see his right shoulder is marked, his left shoulder also marked. I guess we injected both. He'd actually fallen off a mountain bike a year earlier, lost consciousness, and fractured his scapula, his shoulder blade. And on clinical exam, um, uh, I guess it was June that he fell, and then in November we did the treatment. On clinical exam, his subscapularis was apparently injured, You can tell when you put your hand behind your back like you're being handcuffed and lift it off. If that hurts, then it's probably damaged. So what happened was his subscapularis was hurt when he got thrown from the mountain bike. So anyway, long story short, we microneedled his scalp also with 2 billion exosomes and 2 billion amniotic fluid. Uh, well, not really 2 billion, it's 2 cc's amniotic fluid. And he really didn't experience much significant change, although his shoulders are much better, and I think he's going to do another treatment. All right. So, just I always like to recap what an exosome is. Some people don't know. An exosome is a very tiny product of the cells, all cells, but especially stem cells of the mesenchymal stem cell variety, produce these exosomes, and they're about 1/300th the diameter of the actual cell. Okay, so uh, things like coronavirus, HIV are 100 nanometers, same as exosome. It's because this is the way the machinery is built to put out 100 nanometer spheres with little RNA inside them and sometimes proteins embedded on the surface. Yeah. So if you got a corona vaccine, then you got the envelope or spike protein, I think, mRNA inside one of these lipid spheres. Uh, the actual size of the cells is about 300 times the diameter. These are not cells. They don't reproduce. They don't have their own machinery. Contrary to some conspiracy theorists, it's not going to reprogram your DNA. It's only a temporary message. Although, I guess if it had microRNA, blocking RNA, it could influence downstream cellular phenotype or action. So, little caveat, maybe it could do some reprogramming, but in other words, it doesn't have its own machinery. It doesn't have its own DNA copying machinery, energy producing machinery, etc. And most importantly, they don't have self-antigens, which means that they don't have those major histocompatibility antigens that we talked about, type 1 and 2, that cause organ rejection, that cause autoimmunity, that allow you to protect yourself from other threats. So how would this work? I think number one, there's a anti-inflammatory component to exosomes. Number two, we do see stem cell dedifferentiation, especially with some of the earlier lectures I did on nerve regeneration. Some of the microRNA could be blocking the blockers of dedifferentiation, so that could be waking up some of the hair follicles. We could see decreased telogen duration, something in the life cycle of the hairs. We could be regenerating them, like I said, with blocking. And apoptosis, some of the cells that are damaged could be going into death and then being replaced by some natural function. If you're interested in discussing more, you can contact me. You can learn more at my website. The sort of little coda I want to put on all this is that actually hair loss is a ubiquitous thing. It's more common in certain ethnic groups, Caucasians up to 80%. It's actually a variant of normal, and a lot of people don't like it because they associate it with looking old. Uh, there are some great cosmetic surgical procedures, but again, it is a sign of virility. Quite literally, it means you have a high level of active androgen. But certainly, it also is a sign of aging and senescence, which is related to inflammation, and it's related to stem cell depletion slash differentiation. And as you'll see if you watch the video I did on hair, it's not irreversible necessarily. 12 years ago, I was thinning and I had gray hair. I'm 53 now, taking TA65 type things for 13 years now, and it's pretty good. And I can read 6, 8 inches away. So, at least in that aspect, my vision and my hair has not gone. But the point I want to make is that people are reporting excellent results. I just did my 4th patient with microneedling up in Pacific Palisades, and we'll see how it works. And oftentimes people get a brief flurry of fine hairs or regrowth, but you have to understand that the entire field is somehow damaged either by aging or androgen or inflammation. We don't really understand, but the cell signaling is such that it's not wanting to grow. So Although KW kind of attributes it all to minoxidil, uh, it's possible that there was some cell uh, disinflammation or some improvement that helped him achieve his goal. But the thing I want to say is that a lot of clinics are making a lot of money, and they come in the door and they say, "Oh, you got to do at least 3 treatments." Now, that's just not something typically ethically I like to do. I like people to see results, but perhaps my frame is incorrect. Perhaps it is the kind of thing where you have to do it multiple times and commit to that, because everyone seems to get a little benefit, but whether multiple treatments would get you to a better endpoint, I really don't know. So it's not one that I have a tremendous amount of experience, maybe 4 or 5 people treating, but there's a lot of people making a lot of money off this. Of course, the hair is very popular, and also erectile dysfunction, which I've had more success with. Again, very limited numbers, but I think that's an effective treatment. So anyway, uh, bottom line, everything aging related is kind of the same song, just rhyming over and over again. It's kind of like stem cell depletion, epigenetic reprogramming, and it's not irreversible, as we know from the Yamagata factors. Stem cells can be created even from differentiated cells. So this whole ecology, the language, the music of the way the cells work is fungible, or I guess it's pliable, it's malleable, and there are some tricks that can be evoked. But would I say that this is guaranteed to regrow your hair at this point? No, I probably wouldn't say that. But perhaps I'm just doing it wrong. So stay tuned. If you have any questions, I'm happy to open it up now to questions. And let me close the presentation. There is a tremendous amount of hair in the world. Has anyone tried hair transplants? Well, that's a great question. I mean, people wear wigs, but the problem with hair transplantation is that the cells have those major histocompatibility self antigens, and so the body will reject them quickly. You'll have just a dead graft on your head. Larry asks, where can I get treatments? I mean, I guess you could do a Google search and look around. Again, the disconnect between my experience, which is only about 5 people, versus these clinics that just turn them out. Maybe they're just doing more and they're getting a commitment to at least 3 treatments. I think the technique is largely similar. Most people are using microneedling, which is essentially a painless procedure. Um, no, Larry, it's not Mexico. It's anywhere in the U.S. as long as the doctor's experienced and comfortable providing the service. I practice out of Hawaii, where I live, and California, where I used to live, and I'm returning to. And I will have my Texas, Florida, and Nevada licenses within a month. So we can arrange to meet also. Well, excellent. I know it was kind of nerdy and sciencey and a little ambiguous, but unfortunately, that's this current situation. Nobody really understands hair loss, but it seems to suggest a process of inflammation, aging, and differentiation. And there is hope beyond just the surgical means, although the current pharmaceutical options are quite unsatisfying and fraught with difficulty. So I wish you all well. Hopefully, there'll be a webinar next week. I need to think about what we're going to talk about. But this is Dr. Ed Park signing off on a webinar on hair loss. If you're interested in getting a treatment or trying it, again, this might be the kind of thing where you might want to commit to more than one treatment. So, Dr. Ed Park, thank you for joining. Aloha. Everyone have a great day. Thank you.